Hey guys, welcome to EduTap. I hope each of you is happy, healthy and fine, taking very good care of yourself. I'm your mentor Veer, and guys, this is another video of our newly launched series, especially focusing on the government scheme. Guys, we have already covered 5 important lectures. You can check out those lectures over our YouTube channel. Moreover, you can also check out our Telegram, and where you can download the PDF of those important schemes. So guys, today the scheme that we're gonna cover up is Ayushman Bharat. But before starting this scheme, I would like to share the smiling point of EduTap. Guys, we have achieved excellent results over the years. You can check out in the year of 2019. We have got so many selections, and not even in 2019, also into the year of 2018, we have got excellent results. So guys, now it's time to start the scheme of the day. Ayushman Bharat. Guys, this Ayushman Bharat is also named as National Health Protection Mission. So there are two names, one is Ayushman Bharat and another is the National Health Protection Mission. Now guys, if I try to simplify this, or we can say if we want to cover the gist of this mission is, guys, that there are 3 important aspects related to our health. One is the primary care, the other is the secondary care, and the third one is the tertiary care. I am writing it in short, guys: primary, secondary and tertiary. Primary, in which you need to get attention of the doctor, and just simple attention of the doctor. In the secondary and tertiary, you need to get to hospitalize. So guys, through this Ayushman Bharat, what the government is trying to do is trying to bring uniformity regarding the health sector, as well as the costing, as well as the insurance cover. There are a lot of schemes which are providing insurance cover. They may be from insurance cover or annual insurance cover of 30,000 to up to 3 lakh, even higher than that. So guys, basically Ayushman Bharat is trying to bring up the uniformity in the health sector. How? We will get to know it. So guys, first thing and foremost important thing regarding the Ayushman Bharat is about the objective. What is the objective? The objective of Ayushman Bharat is to bring in, or we can say to achieve, the universal health coverage, which is also a sustainable development goal which India wants to achieve by 2030. So the objective of Ayushman Bharat is to provide the universal health coverage. Now guys, the point I mentioned in the previous slide are here, that it is an attempt to move from sectoral and segmented approach of health services delivery to a comprehensive need-based healthcare services. That means there is a lot of variation in terms of segment as well as sectors. So this Ayushman Bharat wants to bring in the uniformity. How? We will cover it in the coming slides. Now guys, there are 2 important components of this Ayushman Bharat. One is Health and Wellness Center, and the other is the Pradhan Mantri Jan Arogya Yojana. So guys, the 2 components here cover different aspects. One is regarding the primary health care, and secondary and tertiary health care are covered through the Pradhan Mantri Jan Arogya Yojana. How? We will cover up one by one. So let's start with the Health and Wellness Center. So guys, in this initiative of Health and Wellness Center, government is trying to create almost 1.5 lakh health and wellness center across the country by upgrading the existing centers, and these centers will provide the coverage to primary health care near the home. So guys, the primary objective of this health and wellness care is to bring in the primary health cares near your home. And the primary health cares include pregnancy, maternal health services, eye checkups, then dental care, eye care, geriatric care, that means the special attention that the elderly peoples might need, then the chronic communicable disease. Basically, these will cover the simple healthcare needs that different segments of age will require at different point of time, and these services will be brought up to near your home by establishing these numbers of primary health and wellness care. So this is about the primary, that is the first point. And now we talk about the 2 other points, which are secondary and tertiary. How we want to achieve them? Through Pradhan Mantri Jan Arogya Yojana. So guys, this Ayushman Bharat was actually launched in the year of 2018, and this Pradhan Mantri Jan Arogya Yojana was, this date is just to recall that. Now the aim of this Pradhan Mantri Jan Arogya Yojana is to provide a healthcare cover. Important point, guys, healthcare cover, that means it is an insurance product of rupees 5 lakh. The another important point is 5 lakh per family per year. So you are providing under this Pradhan Mantri Jan Arogya Yojana the coverage of 5 lakh rupees annually per family per year for secondary and tertiary health care needs, in which you need to hospitalize, and it will cover almost 10 crores poor and vulnerable families. This figure is important, guys, because this is also a part of objective. So this much of families will be covered up who belongs to the poor and vulnerable section of the society, and this will make the approximate beneficiaries will count to almost more than 50 crores. So guys, these figures that I have circled up, though I have circled up each and every point, but they are important. Through this primary Pradhan Mantri Jan Arogya Yojana, we are trying to cover almost 10 crore families, and we will be providing an insurance cover of 5 lakh regarding the secondary and tertiary healthcare in which we need to hospitalize. So guys, through health and wellness sector, first we bring the healthcare near the houses, and in this Pradhan Mantri Jan Arogya Yojana, if you need to hospitalize, then we are providing you the insurance cover, and that is how you will get the universal health coverage in this Ayushman Bharat. Now coming to the background of this Pradhan Mantri Jan Arogya Yojana, guys, this actually there were a lot of schemes, and one of those schemes that have merged with this Pradhan Mantri Jan Arogya Yojana was Rashtriya Swasthya Bima Yojana. The difference between Pradhan Mantri Jan Arogya Yojana and this Rashtriya Swasthya Bima Yojana, guys, that first in this only 5 members of the family were covered under Rashtriya Swasthya Bima Yojana, but due to this Pradhan Mantri Jan Arogya Yojana, there is no limit on the number of members. If you have 10 members, it is included. If you have 20 members, it is included. If you have 2 members, it is also included. So please remember the difference between the two, and that's how, if you remember, this count is 5 times of this. So it is just taken as an approximation that each and every family has a 5 member. Okay, number of beneficiaries could be more. Okay, so this is the difference between Rashtriya. So moreover, guys, under this Rashtriya Swasthya Bima Yojana, there were different annual coverages that were being provided. I mentioned the figure in the first slide at 30,000, from 30,000 to up to 3 lakh. These were the coverages that have been provided under Rashtriya Swasthya Bima Yojana. Now there is a uniform coverage of 5 lakh under Pradhan Mantri Jan Arogya Yojana. So guys, this is an important point you need to remember, that the difference between the two is it has brought up a uniformity in terms of the annual coverage which is being provided to you. So now guys, that was about the background. Now we talk about the funding of this scheme. So guys, this is a basically centrally sponsored scheme. So the funding pattern is 60:40 will be the funding pattern for the central and state government, and 90:10 will be for central and state in case of northeastern states as well as the hilly states as well as the union territory. So guys, this is the funding pattern of Pradhan Mantri Jan Arogya Yojana. Now guys, there are certain eligibility criteria as well as exclusion criteria regarding the beneficiaries. So guys, who will be included comes under the eligibility criteria. Families that have one room with kacha or kacha roofs, they will be automatically included, and they will be issued an e-card and that e-card can help them as a beneficiary under this Pradhan Mantri Jan Arogya Yojana. Now the second point is that family who have no adult members between the age of 16 to 59 will also be included in this. Then the female headed households, disabled members, SC/ST households, and there are other a long list is there, like manual scavengers will also be included in this weaker section of the society. So guys, there is a long list. I just want to give you an idea regarding the who are eligible, basically the poor and vulnerable sections of the society. Now there is this exclusion, guys. So there are few people who will be automatically excluded from the benefits of Pradhan Mantri Jan Arogya Yojana. First of them is the person who has a Kisan credit card with a credit limit of more than 50,000. So he will be automatically excluded from the benefits of Pradhan Mantri Jan Arogya Yojana. Now the second is any member of households earning more than 10,000 per month, he will also be excluded. Not only this, there is a long list, like if you are a taxpayer, you will be excluded from this Pradhan Mantri Jan Arogya Yojana. If you have a 2-wheeler, 3, 4-wheelers, then you will be automatically excluded. So guys, there is a long list again in case of exclusion as well. So their pupils have been included and excluded, and the latest data that will be to include the we can say the members or beneficiaries under this Pradhan Mantri Jan Arogya Yojana is based on the latest data of socio-economic caste census. I'm writing it again, guys. Socio-economic caste census. So the latest data of this will be used to identify the beneficiaries under the Pradhan Mantri Jan Arogya Yojana. Now, guys, there are some key features regarding the scheme. So, guys, the first key feature is about that there will be a 3 days of pre-hospitalization and 15 days post-hospitalization coverage for the expenses regarding your diagnosis or your health status. So, guys, basically under Pradhan Mantri Jan Arogya Yojana, you will getting a pre as well as post-hospitalization expense coverage. So, this is the first point. Now, the second point is the benefit of the schemes are portable across the country. So, guys, if there is no constraint regarding the geography, if you want to hospitalize in Delhi, you can go to Delhi. If you want to hospitalize in Shimla, you can go to Shimla. Or if you want to go to Chandigarh, you can go to Chandigarh. So, guys, there is no constraint regarding the we can say the coverage in this in terms of geographical area. Now, there is third point is the beneficiaries can avail benefit in both public and empaneled private facility. So, guys, not only the public sector hospitals are covered, there are selected private facilities which are also covered under this Pradhan Mantri Jan Arogya Yojana, and you can we can say you can get this benefits even in the private facility as well. Now, the last point is about, guys, the services included approximately 1393 procedures covering the cost related to treatment. So, guys, what government has done that the treatment cost of same disease might go up and down. So, to keep the cost in check regarding the treatment in the private facilities in particular, what government has did, government has came up with the different packages. Okay, and these packages are these in numbers. For example, there might be certain disease which have been covered. So, there are certain packages regarding that disease and you can opt for, and accordingly there will be the expenses, keeping in mind the disease as well as the procedures which need to be followed. So, guys, these are the number of packages that have been covered under this Pradhan Mantri Jan Arogya Yojana, and these facilities are now available as in the private as well as the public hospitals. So, guys, these are the key features. Now, there are the important milestones regarding the Pradhan Mantri Jan Arogya Yojana. First time it was announced in the Union Budget of 2018. Then there was different procedures which were followed. Its CEO was appointed. Then the next big change came into the picture in the year of 2018 September 23 when this Ayushman Bharat Pradhan Mantri Jan Arogya Yojana was launched. Now, guys, there are over the period of time there have been different changes and different achievements, and if you see that in the month of May 2020 almost 1 crore hospital admissions have taken place under this scheme, and in August 2020 almost 12 crore beneficiaries were there, and hospital empaneled are 22,796. So, guys, what is important are these facts, and guys, we are covering this scheme right now. So, we have taken up this as the deadline. But if your exam is going to be happen next year, maybe in the month of Feb 2020, so this data will become less important, and the coverage from September till February 2021 will become important, because we know that our exam is highly current affair oriented. So, you need to refer the latest data. I am again repeating it, because the number of these hospital empaneled might go up to 24k or even higher, and these number might also go up to 2 crore. So, you need to refer the latest data. That's what I want to convey here. So, guys, that was about the Pradhan Mantri Jan Arogya Yojana. We have covered Ayushman Bharat, the health and wellness sector, as well as the Pradhan Mantri Jan Arogya Yojana in detail. Now it's time to revise the scheme through some MCQs. So, guys, first is about the launching year. This is an important question, can be asked in the phase 1. So, the launching year is 2018. Then the scheme is under which ministry? I hope it's very simple as it's related to the health. The answer is the Ministry of Health and Family Welfare. Now, the third is the insurance cover under the scheme is 5 lakh. This is a uniformity in terms of coverage. Basically, we are talking about the Pradhan Mantri Jan Arogya Yojana in this question. Now, the number of health and wellness centers to be established under this Ayushman Bharat is 1.5 lakh. Now, guys, currently there are more than 50,000 health and wellness center who have already been established. So whenever your exam is, you need to refer latest data. This is, I am repeating again. So before your exam, refer the latest data, because this question can be asked even on the number of health and wellness center that have been established. So please refer this before your exam again. Now the next question is about the implementing agencies. Who is the implementing agency of Pradhan Mantri Jan Arogya Yojana? The answer is National Health Agency, guys. This is the agency that has been established under the Society Registration Act, and this will coordinate with the state agencies in regard to the implementation of Pradhan Mantri Jan Arogya Yojana. Now the budgetary allocation for the current financial year. This is always an important question from the phase 1 as well as phase 2 point of view, and the answer is 6,400 crore. And guys, the last question of today's lecture is the number of empaneled hospital. I mentioned it in the that slide also, though the answer is 22,796 as on August 2020. I am repeating again, please refer the latest data before your exam, otherwise you will get less marks. So guys, this is important, and I have mentioned all the different types of questions that can be asked from Pradhan Mantri Jan Arogya Yojana. So guys, that's all from my side regarding the Ayushman Bharat as well as Pradhan Mantri Jan Arogya Yojana. If you like our video, please subscribe to our YouTube channel, share it with your friends, and do give a thumbs up. Moreover guys, if you want to download our PDF, you can check out our Telegram group for not only for downloading but also for the latest updates. So guys, that's all from my side. I'm your mentor Veer, now signing off.